topic for today is the intersection of autism and LGBTQIA plus identities. But LGBTQIA plus um, includes a really wide variety of identities. There's also variations of the acronym itself that different people use. It covers sexuality, which is someone's physical or sexual attraction, romantic orientation, so who someone is emotionally or romantically attracted to, as well as gender and gender identity. And in the time that we have today, I can't possibly cover all of those aspects. So I'm going to focus on gender identity, but I am happy to answer any questions about other aspects of identity at the end also if we have time. Um, this is just kind of my breakdown agenda for today. And then just as an introduction to myself, I am a program manager at the UC Davis Mind Institute for a range of autism research studies with kids ages 2 to 18. And I identify as queer, neurodivergent, female, cisgender, and white. So the obvious question to start us off is, what is gender? And I'm actually going to start with what gender is not. So gender is not biological sex. And most frequently, the term sex now is used to describe biological features, but the development of what we refer to as biological sex is impacted by so many factors, including but not limited to genes and chromosomes, epigenetic factors, hormones, endocrine system. And usually when we talk about sex, we actually just mean sex assigned at birth. So when an infant is born, this is the doctor looks at visible external genitalia and decides what sex will be written on the birth certificate. And they tell the parent it's a boy, it's a girl. But without a much more detailed evaluation that most people never get, we don't actually know how many of these other biological factors align with a sex assigned at birth or to what degree. So knowing that gender is not the same as sex, we'll look at what it is. And I have Gender Unicorn, which is my favorite worksheet because it breaks down that there's a lot of different components to identity. And so gender identity is a personal innermost sense of being female, male, neither, both, different gender, but it is a personal internal experience. And some terms that I'll use as we talk about this today. So cisgender is a gender identity that matches the sex that someone was assigned at birth. So if we had a baby and the doctor said it's a girl and that child grows up and identifies as female, as a woman, that's someone who's cisgender. Transgender is a gender identity that is different from the sex assigned at birth. So if it's a girl and grows up to identify as non-binary or grows up to identify as male, those all fall under kind of this umbrella term of transgender. And there's a lot of different identities as well that are more specific, but I'm going to be using that today as kind of our overarching term. And then gender expression is also different than gender. And that's kind of if gender identity is the internal experience, gender expression is the external version. And that can include things like hair or voice, body shape, where someone has curves or doesn't have curves, and what we think that means. It may or may not align with someone's gender identity. And when I say that, I mean someone's gender expression may or may not align with our stereotypical expectations of a particular gender. Because gender is performative. It is a social practice that everyone engages with to varying degrees of awareness. It is something that's decorative, it's behavioral, and it's very much based on social norms and expectations. And someone's gender expression may also differ depending on their setting, the supports they have, how safe they feel in a given environment. Being trans is not contingent on any expression or things like names and pronouns. And in a social context, someone's decisions about gender-related medical care, so-called biological sex, things like their name or appearance prior to transition, if those are things they changed, those are no one's business but their own, and they can share that with who they want. But in a clinical setting, do you recognize that you sometimes do need to know some details? So recognizing what is a person comfortable sharing in a lot of contexts, trans, gender diverse people going into a medical environment do not know how the medical provider is going to be supportive or not supportive, and it may take a little bit longer to build rapport. If you're asking for information explaining why you need it, so I'm asking this because it would make a difference in terms of medical treatment in this way. And then if you don't need information to provide care to a patient, you don't need to ask. If they want to volunteer it, they totally can, but leave it in their hands and their control. So thinking of gender identity, I'm going to talk a little bit about how that develops. So that inner sense of gender identity begins to develop really early, around age 2 to 3 for most typically developing children. And then children begin to understand gender as this sort of category where you can classify people around you, starting around age 5. And again, ages for typical development, and gender identity is a part of development. It can be impacted by developmental delays. In a 2015 study of trans adults, they found 80% knew their gender identity before age 10, 96% knew it before age 18, and the average age when they realized that their gender identity was different or it didn't align with their sex assigned at birth was around age 8. But the average age of understanding how to describe those feelings wasn't until 15. And so we have this kind of discrepancy between when children start to recognize their gender experience and when they develop the language and context for understanding it. So I'm going to switch gears real quick and talk a little bit about neurodiversity. With this audience, I'm going to assume this isn't a new concept, but I do want to quickly run through how I conceptualize it, so you can kind of understand my approach as I talk about neurodiversity and see the parallels in terms of how we can think about gender diversity. So the term neurodiversity originates from this concept of biodiversity, which describes the fact that there is a huge amount of variation in biological living things on this planet. So for example, these are all flowers. They look different. There are various colors, there are various shapes, but none of them is more correct or less correct of being a flower. So a dandelion isn't better at being a flower than an orchid, but dandelions will just shoot up from any crack in the sidewalk, and an orchid needs particular light and water and nutrient requirements in order to thrive. And so when we have, different options, they may need more care, they may need more time, they may need a different environment in order to thrive as best as possible. And so that same concept applies to brains. There's no right kind of brain, there's just different ways of perceiving and interacting with the world. And so in understanding neurodiversity, we know some of the key aspects to supporting someone. We know that everyone has strengths and challenges, but that people are inherently valuable no matter what their supports, what supports they need, or how they can quote unquote contribute to a society. And we also know that supporting neurodiversity means not thinking of brains or people as broken. They don't necessarily need to be fixed or cured, but they may require different levels of support or assistance. We presume competence, treat people as if they know and understand themselves, and also know that quality of life isn't something that you can determine for someone else. So the goal should always be to treat and support someone in a way that allows them to live the life they want, which may not always look the way that you think is so-called right or is expected. And you can probably already see some of the parallels here with an approach to gender diversity and how to support trans individuals. So going a little bit more into kind of that intersection. Before I go into this, as a note, most research on this topic is focused on children and adolescents, and it's the majority of what I'll be sharing here. And so kind of similar to how autism research as a whole has historically focused on children, and it's only relatively recently that we've started to see the field branch out into research on autistic adults. We see a similar pattern and this kind of gap in current literature when it comes to gender diverse and neurodivergent adults and things like co-occurring conditions or unique challenges. Also want to note that all the research that I'm presenting on this topic is from prior to the 2024 election, and so we don't yet have a full picture of how changes and restrictions to gender-affirming care may uniquely affect neurodivergent individuals. So in a large meta-analysis that reviewed several data sets totaling over 640,000 individuals, 31,000 autistic, 4,000 gender diverse, they found that trans youth were about 3 to 6 times more likely to be autistic as cisgender individuals, and I have my little asterisk here of specifically more likely to be diagnosed as autistic. And so we can kind of infer that it may actually be higher because we know it is difficult for people to get diagnoses. And trans individuals are more likely than cisgender individuals to report that they suspect they have undiagnosed autism. And we also know that there are higher rates of ADHD, mood disorders, learning disabilities, We also see higher rates of suicidal ideation among trans autistic youth, which is already high among all trans youth, but can be even higher when you have this compounded intersection. And then in an actual study with adults, smaller study, not the 640,000, but smaller study, they found about a third of autistic gender diverse adults had reported that their gender identity had been questioned because they had an autism diagnosis. And this can look like things like being told they don't understand gender because they're autistic, or gender is just a special interest and not an identity, which, as you can imagine, is very invalidating. So supporting this and using kind of those same principles, knowing that gender is a different experience for every person, and this isn't just speaking about transgender individuals. So as a cisgender woman, my experience of gender is also very different from some other people who also identify as a cisgender woman. So there's a really wide spectrum. But that unique intersection of neurodivergence and gender can create this particular experience and identity. We know that neurodivergent brains process information differently. I say often, but we know they process information differently than neurotypical brains. And things like social and executive functioning challenges may affect transgender neurodivergent people's ability to conceptualize gender, to describe it, as well as to kind of figure out what they need to do in their life to meet gender-related goals and the steps that need to be taken. We also know, as I mentioned earlier, that social norms and expectations are a huge part of gender identity and gender expression. And so different patterns of social development can also alter kind of these timelines or frameworks that individuals have for understanding and conceptualizing gender. And then medical transition is a term that refers to any medical or surgical actions taken to align someone's body with their gender identity. And one of the most common ones that you may be familiar with is like hormone replacement therapy. Detransition means stopping or reversing any medical actions taken to affirm a gender identity. And on the previous slide, I mentioned the autistic adults who said their gender identity was questioned because of their autism. But I think it's key to note that autistic adults who medically transition are not any more or less likely to detransition than non-autistic adults. We kind of see the same outcomes for both. So, wrapping up here. In terms of supporting these individuals is taking time to educate yourself outside of clinical spaces, which you are all already doing by being here today. But not relying on patients to educate you about broader concepts related to things like gender or sexuality and keeping interactions about them. But if they are bringing up terms or concepts that you're not familiar with, you can ask, what does that look like for you? Or how does that affect you with friends? And just like with neurodiversity, presuming competence. So individuals know themselves better than anyone else. And people who are non-speaking, who have limited spoken language and or have intellectual disability still have gender identities. They still may have preferences that they need supported as much as those of speaking individuals, and taking the time to give them opportunities or ways to express that is really critical. And just because someone doesn't have the language to describe their experience doesn't mean they don't have that experience. And even looking at the sample where age 8, they recognized an experience and not till 15 had the words, but that didn't change the fact that they had that experience. And then in the same way that autism and neurodiversity are viewed differently across culture, so is gender. And I hope I've driven this home at this point, but gender is a social construct. It is not the same across all cultures and societies. Historically, there have been non-Western cultures where trans, non-binary individuals were often celebrated. They held positions of honor within communities. And unsurprisingly, things like colonization, cultural erasure have been incredibly damaging to that. And there are some communities and individuals who are reclaiming these identities. There are others who also just no longer embrace or understand these ways of conceptualizing gender, and they're more used to our Western views or more firm adherence to things like binary concepts of gender. And both of these are okay. there is no shame in having worldviews shaped by the culture that you're raised in, but knowing that there are other perspectives and the ways that we need to respect those. And things like being raised in particular religion or cultural background or political ideology all can have this significant impact on a person's understanding of identity and the support that they receive from other people in their life. And so just to close, this is a quote that I really love, and it is actually the final paragraph of Origin of Species by Charles Darwin, where he describes endless forms, most beautiful and most wonderful, have been and are being evolved, which is my favorite way of thinking about things like neurodiversity and gender diversity, and thinking of forms most beautiful and most wonderful.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.